My name is Lisa Bartholomew, and I'm a registered dietitian. I will review sections 5 through 7 and the summary section. This is about following therapeutic diets related to Area 0904E. Following therapeutic diets can be difficult for the facility as well as residents. There are a wide variety of therapeutic diets that address patients with different needs. And let's remember these two key points. The diet must be resident-focused. Therapeutic diets may result in reduced intake, weight loss, decreased quality of life for residents. So remember to stay focused on the resident and the resident outcomes. And we also don't have to memorize or know everything about each kind of therapeutic diet. We should rely on the facility's menus and their rules. So what is a therapeutic diet? A therapeutic diet is part of the treatment plan for a disease or clinical condition used to eliminate, decrease, or increase certain substances in the diet, for example, sodium or potassium, or to provide a mechanically altered food when indicated. Therapeutic diet orders, 0904E4, that rule reads all therapeutic diets, including thickened liquids and nutritional supplements, shall be served as ordered. When applicable, the therapeutic diet order shall be specific to calorie, gram, or consistency unless there are written orders that include the definition of any therapeutic diet identified in the facility's therapeutic menu, which are approved by a licensed dietitian or nutritionist. For example, you may include total caloric intake for calorie-controlled ADA diets, consistency of thickened liquids, and the amount of fluid restriction. The facility shall maintain a current listing of residents with physician-ordered therapeutic diets for guidance of food service staff. Key point here is if the diet order is not complete, as stated in the rule, the order is to be clarified unless the facility's approved menu clearly defines the diet. Therapeutic diet orders and related orders, they come from the FL2 and provider orders, which could include hospital and specialists orders. They write orders for the diet, supplements, specialty referrals, weight or blood pressure checks, labs including fingerstick blood sugar results. There's orders with specific parameters and order clarification as needed. Remember to document all resident refusals and notify the provider. Adjust the care plan and or consider order changes when necessary. Remember to always communicate changes with the resident, the family or the guardian, and healthcare providers. These are 9 types of therapeutic diets. This is just a general list. Some of these may not be ordered very often, and some facilities will have all of these therapeutic diets, and some will only have 1 or 2 of them. The diets listed are calorie controlled, carbohydrate controlled, or no concentrated sweets, no added salt, low sodium, low fat, low cholesterol, renal, gluten-free, or modified consistency, and that modified consistency can relate to foods or liquids or both. Combination diets are typically not addressed on menus, and there should be no guessing. The facility should contact the menu provider for a combination diet or clarify the order with the provider and inform them that the facility does not have a menu for a combination diet. Now we're going to talk specifically about these diets, what kinds of problems and diagnoses they address, and the potential or actual outcome of the resident when diets are not followed as ordered. Let's start with calorie-controlled ADA diets. On this slide, ADA stands for the American Diabetic Association. Residents with diagnoses including diabetes, prediabetes, and those that require blood sugar regulation and weight loss management may be ordered a calorie-controlled ADA diet. The focus of this diet: count calories or control calories, carbohydrates, sugar, protein, and fat intake in balanced amounts to meet nutritional needs, control blood sugar levels, and control weight. Common calorie intake levels may include 1,500 calorie, 1,800 calorie, and 2,000 calories daily. This requires correct measurement of portion sizes. And remember, calorie-controlled diet orders must specify the calorie intake level. Key points to remember: staff should use appropriate measuring utensils when serving these diets. Menus for calorie-controlled ADA diets will be specific about portion sizes and will eliminate food groups to meet specific calorie levels. And where applicable, the therapeutic diet order will be specific to calories, grams, and consistency. A carbohydrate-controlled diet. These are ordered for residents who have diagnoses including diabetes, prediabetes, and or require regulation of blood sugar, may be ordered a carbohydrate-controlled diet. Counting sugar and carbohydrate intake is the focus. It requires correct measurement of portion sizes. The emphasis is on eating the same amount at the same time each day to maintain those blood sugar level goals and recommendations. And remember, carb-controlled diet orders must specify the carb intake level. You may see residents with diagnoses of weight loss management or high blood pressure who are also prescribed this diet. Staff should be using appropriate measurement utensils when serving. Carbs are broken down by the body into sugar. And essentially, this diet is about controlling sugar and carb intake. Foods like bread, cereal, pasta, rice and other grains, starchy vegetables like corn, winter squash, and potatoes, dried beans, fruit, and milk have a significant amount of carbs. No concentrated sweets diets is another diet, and it's considered a more liberalized diet for residents with diagnoses of diabetes, prediabetes, or require regulation of blood sugar. Generally, the focus is on offering foods on a regular diet, but it doesn't include the addition of sugar. It eliminates foods with sugar, high fructose corn syrup, honey, molasses, and maple syrup. In general, this is the simplest version of a diet for individuals with diabetes, prediabetes, and or require regulation of blood sugar. Liberalized diets are less restrictive and are used to improve food and fluid intake and increases meal enjoyment and satisfaction and or the quality of life. Calories are not counted in no concentrated sweets as they are in ADA calorie control diets, and portion size control is not the focus of no concentrated sweets diet as it is with the carb controlled diets. Potential outcomes for residents. Let's discuss those potential outcomes. We just discussed those three key diets most often ordered for residents who have diabetes: calorie control, carb control, and no concentrated sweets. And here are some outcomes that can be acute, short-term, or long-term. Outcomes are not only about high blood sugar results. High blood sugar causes damage to vessels, leading to many complications. Those outcomes could be high blood sugar, kidney disease or insufficiency, heart disease, nerve damage or neuropathy, eye disease, peripheral vascular disease, skin breakdown, altered wound healing, increased risk of stroke, diabetic ketoacidosis, diabetic coma, or even death. It is important to look at the entire picture related to these potential outcomes. It is also important to consider that sometimes residents may refuse or be non-compliant with their diet. Be sure relevant medical providers are aware of resident refusals or non-compliance with orders. That would relate to Rule Area 0902B, healthcare. No added salt diets. Residents with diagnoses including but not limited to high blood pressure, heart disease, edema, which is swelling, and or kidney disease may be ordered a no added salt diet to help manage high blood pressure, fluid retention, and or edema. The focus is the use of table salt. Salt is restricted and salt may be limited in cooking. So ensure the menu and the recipe is being followed. Typically, it provides about 3 to 4 grams of sodium daily, which is also listed on labels as 3,000 to 4,000 milligrams. The resident should not add salt once the meal is served. Some things you may observe related to no added salt diets may include use of low sodium or reduced sodium foods or no salt added foods. You may see the use of fresh or frozen fruits and vegetables instead of canned ones. And rinsing canned vegetables before preparation can help reduce the salt. You will also see use of various spices instead of salt for seasoning. The hint here is follow the menu, because all of that information is listed on their facilities menu. The 2-gram sodium controlled diet differs from the no added sodium diet. You will also see this for people who have high blood pressure, heart disease, edema, kidney disease. They may be ordered this 2-gram sodium diet to help manage high blood pressure, fluid retention, or edema. Generally, the no salt should be added during cooking or at the table. And a 2-gram sodium diet order is much more restrictive than a no added sodium diet. It limits sodium to 2,000 milligrams of salt daily. It may be necessary to prepare foods for this diet separately from all the other foods, and ensure any substitutions made to the menu meet sodium intake restrictions. The menu for a 2-gram sodium diet may limit milk servings and may limit items like biscuits and cornbread. So again, here, the hint would be follow the menu. Low fat, low cholesterol diets, they're ordered for residents with diagnoses including but not limited to heart disease, high cholesterol, high blood pressure, diabetes, multiple sclerosis, weight loss management, gallstones, and several other conditions. The focus on this diet is on restricting fat and cholesterol intake. It requires correct measurement of portion sizes, and the menu may indicate low-fat versions of specific entrees and vegetables. Again, follow the menu because all those items are listed specifically on the low-fat, low-cholesterol diet menu. Renal diets, they're for residents who have a diagnosis of chronic kidney disease or end-stage renal disease. These orders for these type of diets are not seen very frequently, but its focus is on keeping the level of electrolytes, minerals, and fluid balanced in the body. Residents who require dialysis are often ordered a renal diet. It requires the correct measurement of portion sizes, and efforts should be made to limit substitutions on this diet, as this diet is very specific. It restricts intake of protein, phosphorus, and salt. It may restrict the intake of potassium and calcium. It may also include fluid restrictions. So this requires correct measurement of fluid intake if that portion is also ordered. If a resident is on a fluid restriction, be sure staff is knowledgeable of that restriction and how to document liquid intake appropriately. If a resident goes out to dialysis, lunch and appropriate snacks may need to be sent dependent upon their dialysis schedule. Again, because this item is so specific, follow the menu. Potential outcomes of failure to follow a renal diet. The big one is fluid overload, which is swelling, high blood pressure, fluid in the lungs, and heart failure. Abnormal fluid electrolyte balance in the bloodstream. Examples include phosphorus, potassium, and calcium outside of ordered goal range, abnormal blood sugar results, and secondary hypoparathyroidism, which is a condition in which the body produces low levels of parathyroid hormone. Failure to follow a renal diet could also lead to death. It may be necessary to contact the kidney specialist known as a nephrologist and or the dialysis clinic to obtain the most current diet orders and lab orders and their results. Individuals with end-stage renal disease who require dialysis frequently have labs and diet orders changed based on lab results. Labs are drawn at the dialysis center frequently. Fluid restriction orders are sometimes implemented on short notice based on presentation of the resident and events that occurred while the individual was receiving dialysis. This information and outcomes are relevant to individuals receiving both hemodialysis, which is done several times a week at a dialysis center, or peritoneal dialysis, which is done daily and can be done at home or at the facility. Gluten-free diets. These are for people who have celiac disease, gluten intolerance, and other conditions related to gluten. This is seen more frequently now. It completely excludes gluten. Gluten is a protein found in wheat, rye, and barley. Intake of gluten can lead to abdominal pain, nausea, bloating, diarrhea, fatigue, gas, anemia, and a gluten-free diet is used to manage those signs and symptoms. Naturally, gluten-free foods include fruits and vegetables, beans, seeds, legumes, and nuts in their natural unprocessed forms, eggs, lean, unprocessed meat, fish and poultry, and most low-fat dairy products. Celiac disease, which is an autoimmune disease, is becoming a more prominent diagnosis. When gluten is eaten, the body mounts an immune response that attacks and causes inflammation in the small intestine. These attacks lead to damage to the villi, small finger-like projections that line the small intestine that promote nutrient absorption. When these villi get damaged, nutrients cannot be absorbed properly into the body. Gluten-free choices are available, such as rice, soy, corn, potato, bean flours, and hominy, which is a type of corn. Again, here the diet will be very specific for gluten-free on their menu, so it will be very important to follow that menu exactly. Let's talk about Diet orders with texture modifications. Residents with diagnoses including but not limited to progressive neurological disorders like Parkinson's disease or Huntington's disease, or cognitive orders like dementia and Alzheimer's disease, problems swallowing or chewing, problems controlling the amount of food in their mouth, poor dentition, no teeth, digestive issues, diverticulosis, and cancers or injuries to the head and neck may be prescribed a diet with texture modification. Texture modification can be ordered for both foods and fluids, dependent upon the resident's diagnosis, acute or chronic conditions, and assessed needs. An example of an acute condition may include dental surgery or tooth extraction, leading to orders for a mechanical soft diet for a designated time frame. For chronic diagnosis, you may see or hear the word dysphagia used as an indication for texture modification of food or liquid. So what is dysphagia? Dysphagia is a condition in which an individual has difficulty accepting, chewing, manipulating, swallowing, and digesting foods and liquids. It can result from a condition and any other diagnoses. If left untreated, it can cause choking, aspiration pneumonia, pneumonitis, and even death. Some causes of dysphagia include, but are not limited to, stroke, brain injury, muscle weakness, dental extraction, poor dentition, head or neck cancers or injury, and cognitive issues like Alzheimer's or dementia. Dysphagia is a big deal, and all diet orders related to it must be taken very seriously. This is a graphic that shows what can happen when modified diets are not served as orders. Food could get into the lungs instead of going into the stomach where it's supposed to go. Look at the areas in yellow. The area that leads to the lungs are in the front of the throat, while the areas that lead to the stomach are in the back of the throat. In individuals with dysphagia, consider proper positioning during food or fluid intake. If you look at the positioning box, residents should be in an upright position with their head up and elevate the head of the bed if they are not able to get out of bed for meal times. They should not be laying flat. They should not be reclined. Staff should sit at or below eye level when feeding residents with dysphagia. This makes it easier for the resident to maintain their head in the appropriate position. You will need to watch residents. Are they repeatedly clearing their throat, coughing, vomiting, choking? If you observe this, you need to alert or get staff to assist the resident. Pureed diets. Residents with diagnoses including dysphagia and or any chewing or swallowing disorders may be ordered a pureed diet. The focus here is texture modification, which should require no actual chewing. Pureed foods have a smooth, soft texture similar to mashed potatoes. It should hold its shape at room temperature without becoming watery. And foods should be pureed separately, not combined all together. That's yuck. You do not want to combine all the foods into one item and mix them all together. All foods should be served. You don't want to exclude foods like breads. And the menu should provide instructions on preparing those types of items. It requires a food processor or blender for preparation, and thickening agents may be required to produce appropriate pureed consistency. Again, we're looking at the whole picture here. Trouble with chewing and swallowing may occur for many reasons, such as mouth pain, poor fitting dentures, or missing teeth. Even certain cognitive or neurodegenerative diseases such as Parkinson's or dementia. Pureed diet menus typically avoid nuts, seeds, raw vegetables, and raw fruits. In this slide, the peas do not look smooth because some facilities use pureed foods that come in food molds, which help with food identification, but the peas should still be very smooth. It may be necessary to observe the preparation of pureed menus to ensure all food groups are included and thickener is added if necessary. Ensure staff follow the recipe and the prep instructions. Again, the menus for pureed diets are very specific, so they should be following the menu. Mechanical soft diets, residents with diagnoses including poor or no dentition, mouth pain, ill-fitting dentures, digestive disorders, dysphagia, and other chewing and or swallowing orders may be ordered a mechanical soft diet. The focus here is on foods are easy to chew. This is very different from a pureed diet, which requires no chewing. Foods should be moist, soft, bite-sized, and are not too crunchy or sticky. Soft foods may include moist pasta, baked flaky fish, cottage cheese, scrambled eggs, yogurt, oatmeal, soft fruits and vegetables that do not contain seeds or skin. Meats are typically chopped or ground and are usually served moistened with some type of gravy. Trouble with chewing and swallowing may occur for many reasons, like poor or no dentition, mouth pain, poorly fitting dentures, or even certain cognitive and neurodegenerative diseases that we've already discussed. Mechanical soft diet menus typically avoid raw and dried fruits and vegetables, nuts and seeds. Ensure ground menu is not being used for preparation of mechanical soft diet orders. Even though they may be similar, food choices may vary from ground to mechanical soft. Thickened liquids. Essentially, thickened liquids have a higher viscosity, which means they flow slower than regular liquids. The higher viscosity can help deter and prevent choking and reduce the risk or stop fluid from entering the lungs. Thickened liquids, because they move slower than thin liquids, can be easier to swallow and gives the body more time to protect the airway. There are three consistency types, starting from the thinnest viscosity, which is nectar, to the thickest viscosity, which is pudding. So we've got nectar consistency, nectar thickened liquids. That is a consistency similar to buttermilk or creamed soup. It's able to go through a large straw and it glides off of a spoon. Honey thickened liquids, the consistency is similar to honey or molasses. It pours slowly, more slowly than nectar. It will not go through a straw, and it will drizzle slowly off a spoon. Pudding thickened consistency is that of pudding or yogurt. It holds its shape, it's not pourable, and it must be consumed with a spoon. Reminder here is orders for thickened liquids must state the consistency. It just can't say thickened liquids. Here's a visual to see if the consistency is served as ordered. Here you can see that the nectar-like liquids are easily pourable. They're similar to thick syrup, and it forms a thin web over the prongs of a fork. Honey-like liquids are slightly thicker. It drizzles when poured, just like honey would do, and it forms a thick web over the prongs of a fork. And spoon-thick or pudding-like liquids, they're not pourable. They hold their shape. They're like yogurt or pudding, and it sits on the prongs of the fork. And like we said earlier, they must be consumed. with a spoon. They're not going to go through a straw. Thickened liquids may be purchased pre-made at the ordered consistency, or thickening agents may be used to mix in to obtain the ordered consistency. Ice should never be used with thickened liquids because it changes the beverage consistency when the ice melts. Some foods should not be served to residents with orders for thickened liquids because they will melt in the mouth and get too thin. Examples include Jell-O, popsicles, and ice cream. When a resident is ordered thickened liquids, the thickened liquids should be provided during snacks and medication administration. Takeaway here for thickened liquids: follow the menu, the preparation instructions, and directions on all thickening agents used. When thickening agents are added, ensure the directions indicated on the label are followed. Observe to ensure staff are accurately measuring the liquid or food being thickened and accurately measuring the thickening agent using appropriate measuring devices. Ensure directions regarding the time frame between being mixed and served are followed. Most of the time, thickened liquids will continue to thicken as they sit. It's very important that foods that contain fluids are served at the ordered consistency. For example, the broth in chicken noodle soup would not be appropriate for someone with a thickened liquid diet order unless it was thickened, and canned fruits and vegetables usually have a liquid that would need to be drained or thickened also. Here are some commonly ordered thickeners and an example of a pre-thickened beverage. This one's a nectar consistency as it shows on the top of the label. Each thickener has different instructions. If a thickening agent is added, ensure the directions indicated on the label are followed. Observe staff to ensure they are accurately measuring the liquid being thickened and accurately measuring the thickening agent using the appropriate measuring devices. For example, Thicket, the powder, has its own measuring spoon in the container. Directions will usually say 1 or 2 scoops. And some thickeners come in individual package. You may see individual packets for a 4-ounce container of fluid uses 1 package. So if you're using an 8-ounce container of liquid, you would need to put 2 packets in there. Again, all of these are different, so you need to follow the directions on each package or container. Liquid diets are liquid at room temperature. Residents who have just had surgery, dental or jaw procedures, or are scheduled or prepping for specific medical procedures may be prescribed a liquid diet. Liquid diets do not provide enough calories or nutrients and should not be used for an extended period of time. Clear liquid diets, it may be the first step restarting oral feeding after surgery or after an abdominal procedure. Examples of clear liquids include juices without pulp, broth, black coffee, tea, and gelatin. Full liquid diet may be used as a second step after clear liquids are tolerated. Examples include ice cream, pudding, thinned hot cereal, custard, strained cream soups, and juices with pulp. Liquid diets are sometimes necessary for diagnoses including severe diarrhea or a colonoscopy prep, and should only be used for short periods of time. Often, a medical specialist, such as a gastroenterologist or a surgeon, will send diet orders along with scheduled procedure, prep, and or appointment information. And it's very important that there's a system in place to ensure the diet and the prep is completed as ordered. As always, if there are questions related to the prep or the orders, the facility should seek clarification of orders. Nutritional supplements are to be served as ordered, and the resident or the family should not be responsible for purchasing them. Considerations related to supplements. What system is in place to ensure supplements are served as ordered? How are orders or needs for the supplement communicated to the staff? What's the process or procedures for administration and documentation of supplements? Ensure that staff are trained on that process. Are the residents receiving the ordered supplements from staff? Do they refuse? Do staff weigh the residents? How often? Are they having weight loss? Ensure staff are in communication with and follow up with all healthcare providers. Preparation of therapeutic diets relating to meal preparation, plating, and serving. Therapeutic diet list needs to be available to staff and kept up to date at all times. Staff should follow the menu, the recipe, the diet lists, and proper measurements and portion sizes. Preparation of food and beverages is done according to the consistency ordered. Substitutions are of equal nutritional value and appropriate for therapeutic diets. Food supply. Food, beverage, and snack items should be in stock based on therapeutic diet menus and resident orders. Measuring devices, thickening agents, and nutritional supplements are available for therapeutic diets at all times. Considerations for therapeutic diets. What process or policy is used for processing diet orders, clarifying diet orders? What happens when a resident has or receives a diet order for a therapeutic diet that is not included in the facility menus? Who's responsible for ensuring the facility has a menu for all therapeutic orders? How are dietary staff trained to read and follow the menus in the preparation of therapeutic diets? How does the facility maintain food, snacks, and supplements on hand to accommodate menus for all therapeutic diets ordered? How are thickened liquids and altered texture diets prepared? How are staff trained? How are diet orders and diet or nutritional needs communicated to dietary staff and other direct care staff? And what happens when a resident refuses their therapeutic diet or is non-compliant? And that is the end of section 5. Thank you.